Within our plan from the beginning about protecting the state and fighting COVID-19, our number one from the beginning was protect the vulnerable, because we understood that this disease had a disproportionate effect on the elderly and people with underlying conditions. Increased testing, very important. That's been a team effort. The state has done a lot of resources, local, the healthcare providers, it's been great. The appropriate social distancing, that's been done very, very, I think, well on behalf of the people of the state. Supporting our hospitals and healthcare workers, we've distributed huge amounts of PPE throughout the state, and will continue to be helpful when we can on that, and then preventing the introduction of the virus from outside the state. I'm working per the president's request on a proposal for how we deal with international travel. Travel from China and Europe is suspended, but we still have people coming in from Brazil, which is having outbreaks, and so we've got to get a handle on that, and so we're working on that. And then we've screened for our New York quarantine over 50,000 travelers since we instituted the quarantine, and I'm convinced that absolutely helped mitigate the spread in the state of Florida, because you had a massive outgrowth or a massive exodus from New York down to Florida once New York went on mitigation. But protecting the vulnerable is something that is not going to change as we move forward and as we reopen Florida. And we've done a lot up to this point, which is very, very important, but we've got to do even more. You're seeing throughout the country that the bulk of the fatalities are now linked to nursing homes in most states. And some of that was through some bad policy choices, but still, even in places where things were done well, you're seeing that. So we just got to understand the threat and got to do it. So we very early recognized this. We prohibited, required all the staff to be screened and any vendors to be screened. That was to identify people that were ill and that could spread the virus in these facilities. And that requires temperature checks. It requires asking where people have gone. We also mandated the wearing of PPE, like face masks. Anyone that has any contact with a resident has to have gloves, which is also something that's very important at helping mitigate the spread. And then we restricted visitation at long-term care facilities on March 15th. That was a tough thing to do because you're depriving family of being able to go in these facilities, but the risk of an outbreak was such that we felt we had to do it. And then also prohibiting hospitals from discharging COVID-positive residents back to a long-term care facility. At that time, you had some states, like the states like Pennsylvania, New Jersey, New York, some of them Michigan, I believe, who actually required long-term care facilities to accept COVID-positive patients. And you had American Healthcare Association people said, don't do that because you're taking somebody that is contagious and putting them in basically a tinderbox. And I think the results were you've had huge outbreaks in those states. We did the opposite. We understood that it could affect our overall capacity in terms of hospitals, but we viewed it as, okay, if you're putting these patients back in, you're going to end up seeing really rampant spread, and then you're going to end up with more people in the hospital, not less people in the hospital. So that was, I think, an important decision. And actually, the Florida Healthcare Association, they've said that they think it saved thousands of lives. Certainly, when you compare Florida to these other states, how we've done in this environment, very, very important. We've also established COVID-dedicated nursing homes to kind of help with this issue. The one here in Dolphin Point in Jacksonville, that's a relationship between the state of Florida and Dolphin Point. What that allows you to do is if you have a long-term care facility, you identify a resident who's positive. Just because you're positive, even at that age, doesn't necessarily mean you're going to end up in the ICU, but you do need to be isolated. So the resident that doesn't require hospitalization per se, but does need isolation, a place like Dolphin Point can do that. They have the negative pressure. They have the ability to isolate. So you're having transfers out of nursing homes into places that can mitigate or prevent spread. That obviously helps those residents who are still in the nursing home. And so this has been a good model. It's required us to put in resources to it, but I think it's a good use of resources because if you're keeping somebody in those hospital or in the nursing home and then the disease spreads, you're going to have way more health problems than just moving one patient to this. So we have other places around the state where we're going to follow this model, but I think that this is something that would be good, and I think a lot of the hospitals appreciate it too because they have beds, and the beds want to be for the people who really need the care. Some of the nursing home residents obviously need serious care, but some of them just need to convalesce, and so this allows that opportunity without running the risk of spreading through a long-term care facility. We have a whole host of agencies that have been involved. ACA, Department of Health, deploying for infection prevention and control. The Veterans Administration, U.S. Veterans Administration, the VA Secretary is a good guy, called me, said, hey, do you want us to do a field hospital or this or that? I was like, honestly, we have these veterans nursing homes. You got to go in there and help us identify infection, test, do what we need to do. And they said, yeah, we're there. And not only do they do more than just the veterans nursing home. So they've been on the ground as well, which has been very, very important. So you have a huge amount of visits, thousands of visits from these various teams from the very beginning of this. And I think that that's helped reduce the infections that we've seen. The PPE is important because we're requiring them to do this, but in point of fact, most of them didn't have this type of PPE. I mean, some of them had some, but we really needed to put our money where our mouth is, and so we've delivered 10 million masks just to long-term care facilities in the state of Florida, 1 million gloves, 500,000 face shields, 160,000 gowns, and so that shows Florida's commitment to supporting these facilities that house our most vulnerable residents. And then, of course, the Florida, we created 50 National Guard strike teams because we started to see, okay, we have all these screening procedures, we have limitations on visitors, and they're following the procedures, and then we're seeing an outbreak in certain parts. Suwannee County, for example, and it was because of asymptomatic. So we said we need to get people on the ground testing, particularly with an eye to identifying any asymptomatic carriers. And so they've done 238 facilities in probably the last 4 or 5 weeks, 50 different teams, 32,000 residents and staff. It's really, really been effective because as they've identified cases, they've been able to isolate those cases and obviate bigger outbreaks. We also introduced a mobile testing lab. So this is the Cepheid 45-minute rapid test. So we can do about 500 tests a day with a 45-minute turnaround. So this is a mobile lab in a converted RV that will go into communities. Teams will go to different facilities even, bring it back, run the test, and then you have the results the same day. That's a huge thing because if you send it to a commercial lab and it takes 2-3 days, well, you can't, a lot of these people aren't going to be isolated that time, so you could have spread. So this is really, really significant. And then we're also doing Department of Health. I think CDC is going to be helping sentinel surveillance of long-term care facilities. So a surveillance system is not that you test, you're not testing every single person. You're testing representative samples to try to identify any incidents of the disease in various communities throughout the state of Florida. They do it with influenza. We're obviously going to probably end up as a country doing this society-wide for the coronavirus, but certainly for the long-term care facilities, very, very significant. So I raise that just to say that as we go forward, that having our eye on the ball there is very, very important. I think it's 32% of the fatalities in Florida are in the age group of 85 or older. And I think it's about 84% that are 65 and older of all the fatalities we've seen in Florida. That we've not yet seen a fatality under the age of, I believe, 25. So there's a big disproportionate impact here in Florida from people 65 and over. But I would say even more disproportionate as you get into the type of age group that would be at these facilities. You can open up an economy and still protect that, just like you saw other states that refused to protect the facilities, even though they were shutting down everything under the sun. That didn't prove to be effective. And so with the collaboration of local governments, like with the mayor, with healthcare providers, this really needs to be an all-hands-on-deck approach because if we can help keep it out of these facilities, that's going to be a huge part of winning this battle. All right, so phase one. We went to phase one But I made clear that we are going to go smart, safe, step by step. There were things in phase one, and this is the White House task force phase one guidance for what you could, quote, open up. And if you look on some of those things, schools and organized youth activities, we kept daycare open the whole time in Florida, so that was not ever closed. The senior living facilities, obviously, we were restricting the visitation there too. Large venues. So the White House guidance said you can do sit-down dining, movie theaters, sporting venues, places of worship, obviously under physical distancing. We determined in Florida not to do the movie theaters in our initial phase one. We did do limited sit-down dining, and then the places of worship were never closed. I don't think constitutionally you can close it. It's ridiculous. You can go to a liquor store, but you can't go to church. Give me a break. So we really work with the pastors to make it safe, and they understand that there's risk if you don't do it the right way. But I think that collaborative approach, respecting people's constitutional rights, is the better approach. But we knew we could have done more large venues under that guidance, but we decided that was best to do, and I was recommended on my task force to do some more things that we did. Elective surgeries we did put online because I think that's a public health issue too, very important. Gyms could be open and bars remain closed. Obviously the bars are closed in Florida. We did not turn on the gyms at that point. We were working on different safety procedures or whatever, so we really did kind of an initial phase one. We did not exhaust everything that we could have done in phase one. We wanted to go safely, smartly, and then we wanted it to be step by step. And so now we're in a situation where you see kind of what we did. Retail limited, restaurant indoor seating was limited. My recommendations for my task force were to be a little bit more robust on this, but again, we wanted to make sure that we're being very cautious with what we're doing, smart. I got a request after we went into initial phase one from the mayor of Orange County, Jerry Demings, about barbershops and hair salons. And basically he had a task force, a lot of physicians involved, and they're like, look, you can do this in a low-risk way if you do some of these things. So I went down to Orlando, met with some of the salons and one of the barbershop owners. They've got great protocol. You go into these shops, it's like being in an operating room now. It's unbelievable. So we had safety precautions, and then we introduced that the following week. So that started on Monday to do those. And so I think that that's been going very well. But that's kind of our initial phase one. And then obviously bars, gyms closed. As I mentioned, we are requiring hospitals to test all individuals discharged to a long-term care facility for COVID, even if they're not in for COVID. Obviously, you need 2 negative tests if you're COVID positive to go back, but if you're just in for something else, and I think they're testing people anyways with that, particularly everyone who comes in, so we really think that that's good. And then we are telling long-term care facilities, if you can't isolate, we need to transfer those positive residents to places that are going to be safe for everybody, and that falls into Dolphin Point and some of the other things that we're doing. All right, so that's where we were with initial phase one. Here's kind of what you see if you look at some of the cases. Now, clearly, we were having the bulk of our cases at the beginning of April. If you look on April 3rd was the peak for new cases. That was reaching that number with way fewer total cases than what we've been doing recently. So if you see, as we got into early, it kind of plateaued throughout the middle part of April, and then you have seen a decline as we've got to the end of April and through May. And really, in the last, I would say, week, anytime you have anything over, 400 or 500, it's usually related to prison or a nursing home, and that's what we've seen particularly in the last couple days, these prison outbreaks. So in terms of new cases, clearly fewer cases coming in, even with more testing than what we were getting at the height. And if you look at kind of the end of March, the testing was still just really starting to accelerate. I bet you if we had done the type of testing we're doing now, those numbers would probably be twice as high back at the end of March, beginning of April. Here's the positivity rate. So the positivity rate is important when they talk about the gating criteria. You look at the number of cases for the trends, or the positivity rate. And the reason is if you really are trying to expand testing, you're probably going to identify some new cases, particularly in asymptomatic people. But if the overall number is still low in terms of who are testing positive, then that's a good sign. And I think you can see end of March into beginning of April, we were at, roughly 10, sometimes it even jumped up to 15. Now, we never really rocketed high like a New Jersey or a New York, where they were having, I think New York initially was like 60% were testing positive. New Jersey was in the 40s for a long time. So it had always been manageable here in Florida, but you have seen the decline. And if you look at like the past 10 days, you're in 2.6, 1.82, 2.7 some days. The last 2 days, it's increased from there, driven by the prison outbreaks. What you see in the prisons is if it spreads, you have a higher percentage that will test positive than in the general public. And so whereas the general public is still probably about 2.5 to 3.5% of everyone who tests positive, in the prison it's going to be more like 15% or even 20% will test positive there. And so that's really reflected, I think, on the 4.8 there for that. But clearly you've seen a decline in the positivity rate since the apex of the outbreak. And then look at the tests. So just as the 45-day new cases went from left to right, you saw a downward trend. Here, when you go left to right, you clearly see an upward trend. Some of the jagged parts are more just based on how the stuff's reported. So if I have 7,000 one day and then 20,000 the next, probably means I was probably somewhere in between there, just when the labs return it. But we pretty much do 15,000 to 20,000 is kind of where we've settled into. We have capacity to do more. If people want to test at our drive-through sites, walk-up sites, by all means do it. The tests are there for you. But quite frankly, we've not had huge demand at some of these. I mean, I remember Jacksonville was kind of the first indicator. We set it up. People came out, then they dropped, and they expanded the criteria, and it just has always been very manageable. That's a good sign, because if people are sick, they're probably going to want to go in. So it's probably a signal that there's less incidence of the disease. At the same time, if people, even if they're asymptomatic, if they just feel they may have been exposed, come to Jaguar Stadium, go to our other sites throughout the state. But clearly you've seen an increase in testing, and our capacity is more than the 20, I guess the most we've done was 22,464 results in one day. Our capacity is higher than that. You look at syndromatic indicators, that's very important to see how it's progressing. Clearly you saw kind of the peak on this started to go up in the middle of March, and then now it's close to where it was probably at the beginning of the year. Same with the influenza-like illnesses. You really seen a decline statewide in terms of the visits that we're seeing, which is, again, something that you're monitoring. As you look to see with these serological tests and the antibody tests, you'll hear people, man, I had a nasty illness in January. I was negative for the flu, negative for other things. Maybe it was this. You have the antibody. Maybe you did have. We don't really know when it first came to the United States, but my view is if it's in China in November, it's going to be in the United States somewhere by December. And I think we're starting to see that you do see in different parts of the country that it was there. And so you look to see whether you're testing or not is one thing. Whether you even know the dang thing's out there is one thing. But you will see the indications in the hospital if you have people who are getting infected that are in particularly the risk categories. And so this is why looking at the visits is good. You see the cough-associated admissions. Again, doesn't mean they're all COVID, but it's kind of a proxy. Really the peak late March, early April. Same thing with, you see cough, and then also fever and shortness of breath. I remember there was like news reports saying, like, I think it was like kind of, towards the end of March, like, oh, there's this app that's showing Florida's on fire. You have all these fevers. And I'm like, and I asked my guys, I was like, is this scientifically valid? And they're like, no. And I was like, okay, but you look from the end of March, look at how the fever, I mean, it goes down. It didn't explode. I mean, so it just shows you some of the stuff that gets put out there. All right, there's the fatality by date. when states report, they report what's given to them, and that may be the day before, but a lot of times it could be previous. It just depends when it gets reported up. So you saw an ascending on the fatalities, 56 on the 17th of April peak. It's kind of plateaued a little bit, and then has started to go down since then. I'll talk about the hospitalization, critical hospitalizations, which is really the indicators about what risk of fatalities that you're seeing statewide. So here's a good indicator. So when we started the initial phase 1, we had 600 Floridians in the ICU for COVID-19. As of last night, we were at 472. So that's a 21% decrease in ICU COVID hospitalizations statewide from start of phase 1 to where we are today. Ventilator use statewide, we were at 340 on May 4th, down to 232. 32% decline in ventilator use from when we started phase 1 to where we are now. We have throughout the state, I think about 6,500 ventilators that are just available for use. So there was a lot of stuff written about people were going to run out of ventilators. Some said Florida was going to run out of ventilators. I can tell you there was never a danger of that, of anyone that's needed a ventilator has had a ventilator. And then you look at the fatality rate. So if you look apples to apples comparisons, if you do fatalities per 100,000, you look at states like Illinois, Pennsylvania, Michigan, Massachusetts, Connecticut, New Jersey, New York, obviously a much different picture. We do have the most vulnerable population in the country in terms of our demographics. We have thousands of these long-term care facilities. Obviously, we're one of the leading destinations for not only domestic but also international travel, and so that is much better numbers than what we've seen in some other parts of the country. All right, so today we are going to move in effective Monday into what I would call a full phase 1. Some of the things that we could have done but didn't do initially, we are now adding, and I think that this is appropriate given the progress that Florida's made. I think it's fully consistent with our safe, smart, step-by-step approach. And I know I've had people like the mayor asking me, when can we do more, when can we do more? And I appreciate that input because he's the guy that's on the ground. He knows, he's talking to all these folks, the business owners, the moms, the dads, and it's all very important to hear that. And I think we're hearing that throughout the state. I was yesterday down in South Florida with Mayor of Broward County, Mayor of Dade County, and they have plans to go into the initial phase 1. So they're going to be doing that on Monday. They had been counties that we didn't include initially because they had a different scope of the epidemic. But I think you've seen a lot of desire to be able to move forward. I think everyone's committed to being smart and being safe, but I do think people want to move forward. And why would we have moved forward to begin with? Remember, when we went into mitigation as a country, the reason why people said that we needed to do it, because if you let the disease simply spread or spike, you could be in a situation where you overwhelm the hospitals. And the hospitals wouldn't have capacity to treat patients. That would, of course, lead to excess fatalities. So by doing mitigation, you, quote, flatten the curve to make sure that the healthcare system keeps up with this. There were articles written in Florida newspapers in March saying that by April 24th, Florida would have 474,000 Floridians hospitalized because of COVID-19. Now, I don't know what that number means to people that aren't familiar with kind of the system here, but I can tell you we have about 70,000 licensed hospital beds in the entire state. So if they're saying 464,000 hospitalizations, that means you'd have almost 300,000 people with no ability to get care at all. So that was a terrifying prospect. I mean, that was sowing a lot of fear and angst. It wasn't based on any real data or facts, but it was put out there. And so I kept that in mind because I knew, our approach was going to be effective. And on April 24th, we didn't have 464,000 hospitalized. We had 2,000 statewide hospitalized, and most of the hospitals in this state had close to 50% capacity. So the curve was flattened. We never had anyone that was even threatened without having a bed or a ventilator or what they needed. And so because we succeeded there, it doesn't mean the disease is gone. Doesn't mean that we're not going to still have to do things to be able to protect the folks that are the most vulnerable. But the American people never signed up for a perpetual shelter in place, and we need to be able to get society functioning again. So that's why we did it. It was based off the data, it was based off the facts, it was based off the trends, the hospitalizations, and that's why we're now able to go to full phase one. One thing I'll say before I go into this, when you're looking at new cases, and we've seen prison, some of this other stuff, it's important to note that, but the most important thing that I'm looking for are how many of those cases are clinically consequential. I mean, if we're testing asymptomatic people in their 20s, these are people that may never even know they have the disease or have it so mild. So if you have 1,000 people who are healthy in their 20s get it, you're going to have less clinical significance of that than if you had 100 people who are 85 and plus in a nursing home. And so part of our strategy going forward is obviously we'd like there to be no cases, but I don't think that this disease is just going to go away. But can we not have as many clinically significant? And certainly we've seen fewer clinically significant cases over the past 3 or 4 weeks, which is a really, really good sign. All right, so full phase one, what does it mean? The long-term care facility is going to be a big part of phase one, even more going forward. We want all staff to be tested, and that's just very important. That's going to be a multi-pronged approach. We do need long-term care facilities who have the ability to self-test to let us know. We can provide the lab capacity, we can provide the supplies. If you have people who are trained to do that, very important, because that's a force multiplier for us. And we're also going to continue to expand our great mobile testing teams with the National Guard and the Florida Department of Health. From the beginning, we've said any healthcare workers, you go through these drive-through sites, no problem. We also have serological testing. Jacksonville, Orlando, Palm Beach, and Miami, we're going to be expanding that. That's great for healthcare workers to know, particularly if you work in a nursing home. Do you have the antibodies? If you have the antibodies, then that's a huge thing for a nursing home to know about some of its staff members. So we would encourage frequent testing for diagnostic, but also take the antibody test, very, very important. And we are working with the hospitals, just what Ascension is doing by going into these communities and doing testing, particularly at facilities where we may not have any evidence of an outbreak, to make sure there's no asymptomatic spread going on. Very, very important. They've been great here. You have some other places around the state, like the Cleveland Clinic, have done great. And so we just want to encourage hospitals to do that. It's in all of our interest to protect the vulnerable, but also just from a healthcare resource perspective, if you keep it out of the facilities, you're going to devote less resources to patients coming in because there aren't going to be as many as that are infected. And then obviously we were going to work with integrated public health system, local county health departments, very important. Obviously the mayor can work with his here. Carlos Jimenez down in Miami, he's all over this, and it's very, very important. So we want to continue to do that. We're also going to continue to do the elective surgeries. It's important for people's health, and the hospitals have proven they can handle anything that comes with COVID and still do this. All right, restaurants. We had started initially outdoor seating 6 foot apart with 25% indoor capacity. We are now going effective Monday to operating up to 50% capacity, and a lot of that is based off the spacing of the tables, or if you have some type of partition, because I've had some restaurateurs tell me, hey, I got plexiglass, my booths, I can't move them, but I have plexiglass. That's fine. That's effective. All we're trying to do is create a low-risk environment. And I really appreciate a lot of the folks that own restaurants who have been thinking deeply about this throughout this crisis. A lot stayed open to do takeout, but some didn't. And some are more conducive to dine-in. That's just what they have to do. We also, I think, the outdoor seating has been interesting. You've had some cities where they've closed parts of the street so that people can have more room to do outdoors. And that's just based off the science that this thing is not as transmissible outdoors as indoors in an enclosed environment. So I think that that's something that a lot of the people in the restaurant industry were hoping for. I think it can be done safely. A lot of other states already went to that right off the bat. My initial recommendation was to do 50% for my task force. I wanted to ease into it, but I think that they've really thought well about it. So that'll be effective on Monday. And the same with retail. We started off with 25% of indoor capacity, go to 50%. There's very clear guidance from CDC and OSHA and I know a lot of the retailers have been doing it. And look, we were doing retail in some form or another this whole time. You had Home Depot open, you have Walmart, you have all these places open. So there's not a whole lot of difference to me between going into a Home Depot or going into a Joann Fabric or some of these other places. I mean, you can do it, and particularly for our smaller mom and pop retailers, very, very important for them to be able to have safe options for their customers. Museums and libraries, 50% capacity. That'll be local governments can obviously make those calls in terms of the museums and libraries that they're operating. Gyms and fitness centers. So effective Monday, gyms can operate. Make sure that you have respect the social distancing capacity. I would say for some of these places like CrossFit that do outdoor training, that's great. The outdoor stuff, again, that's a lower risk environment in an outdoor than if you're inside a stuffy room in a gym doing something where you're going to potentially be exposed to respiratory droplets. So we would tell people, just like how the restaurants are seeing, I've seen people out in CrossFit and all these other ones doing things outside, that's fine. If you're inside, make sure you're doing the social distance and then sanitize machines and surfaces after use. I mean, that should be happening anyways. I mean, if you're sweating on the dip bar, clean the dip bar when you're done doing dips. I mean, come on. But I think it's important, and CDC was really about close the gyms. And I was like, okay, look, I tried to work constructively, but you think about it, this is a respiratory virus that tends to attack people who have some health problems or who aren't as in good physical condition. So don't we want people to be getting exercise? Don't we want people to stay in shape? It's going to actually make them more resistant to severe consequences. So I think this is good. I think it's important, and that'll start on Monday as well. Professional sports venues, I've been vocal the last couple days. Any Florida team, basketball, hockey, baseball, you obviously could train all you want. Basketball, I know the NBA, some of these places are thinking about getting back in. Go ahead and train, no problem. And then once the season starts, you're going to be able to use our venues, use the venues. We want you playing. I've also said to other teams and other leagues is if you have states that simply are not going to budge and allow even competition with no fans. ESPN in the morning now, you watch, they have Korean baseball on. There's nobody in the stands. So how is that? That's not going to bother anybody. So I think it's important that we get sports back up and running. The mayor and I worked on bringing UFC to Jacksonville. And what was happening was UFC was running into problems in California, some of these other places. They wouldn't let them do it. And I'm thinking to myself, okay, they want to fight in an empty arena. They test the people before they go. That is as low risk as you get. And so I said, if you do, I'm 100%. We reach out to UFC. We said, guys, come. And I think it's been very successful. And then now what happens is UFC knows they have a welcome environment here in the state of Florida, just like WWE knows. And we had to cancel WrestleMania in April. That's hundreds of millions of dollars of economic impact. We've allowed them to keep using their training center and film. They know Florida is a good place to be. We're going to get a WrestleMania back here, as soon as we can and get that economic impact. But any of these teams in other states where they're just not going to let them play, we have additional facilities here. I've already spoken to some of the universities, and I think it would be fine if people want to use facilities here. We welcome it. We think it's very important to do and to get back going. And I know some of the leagues are working on when they come back. Baseball maybe July. I know the NBA. Some of the players are talking about we got to get back on it. So we'll see what happens. But we've I think done a good job of welcoming this stuff done. UFC, there's a charity golf match at Seminole Golf Club down in Juno Beach on Sunday. It's going to be on NBC. You got Dustin Johnson, Ricky Fowler, Rory, some of these great players at probably the best, most iconic course in Florida. And then the following Sunday, you got Phil Mickelson, Tiger Woods with Tom Brady and Peyton Manning. And they're going to do that in Florida too. And both of those events are going to raise millions and millions of dollars for charity. So we're happy that those are being hosted in the state of Florida. Parks can submit reopening plans to the state. They should identify the date certain that they believe that they could resume safe operations. They have to provide how they're going to do it, how they're going to accommodate the guests, how they're going to protect the staff, and then they need to have an endorsement from the relevant official in their locality, Orange County mayor, wherever you're talking about. I was watching during the middle of March when Disney and Universal were still operating. They had determined that they were going to close, but they said, we're going to keep people here through the weekend because the people have nowhere to go. And I fully supported that decision, but they were doing a lot of stuff even then to promote hygiene and distancing. And so I know that they've been working on this a lot. I know Disney's got a run going on in Shanghai. But my goal on all this is let's keep safety first, but let's work and innovate to get to yes on this stuff. So I can't tell you when this is going to be, but I think that we need to say, come up with your plan, show us what you got, work with your local officials, and then we'll see what we can do. All right, so those are that brings us really into full phase one. I think the only thing we're not doing that the president's guidelines permitted were the movie theaters. And I'm not saying we're never going to do that, but I believe, and I've been a broken record on this, when you're in enclosed indoor environments, the virus is just more transmissible. And so how you would socially distance in there, I'm not saying it can't be done, but I would probably need a little bit more information before I pulled the trigger on that. Of course, drive-through theaters are 100% fine and are virtually no risk. And so we'd encourage people to do the drive-through. So we will look and see with some of the things that were permitted in phase one, like the movie theaters, but I think that this is a good approach. I could have done this right off the bat, but I thought that we want to make sure that we're getting our footing, and I think we have done that. I think people have responded very well, and I want to thank the people of Florida for working really hard over a very difficult period of time. I said 2 weeks ago, there's a light at the end of the tunnel. We have a pathway back, and this continues us on that journey. So God bless everyone for all they've done.